one. A very good. Do this again. A very good afternoon to all of our viewers. We want to welcome you to another Let's Talk. We are delighted that you are able to join us this afternoon, and we invite you to give attention because we are going to be talking about something that is of extreme importance. This afternoon, we continue our discussion with Dr. Quintero, and she is joined by Dr. Monica Stevens. In a little bit, we will get going, but before that, we invite you to bow with us for a word of prayer. Almighty Father and our God, we pray for your presence. We ask that you will guide the discussion, take full control, and have your own way in Jesus' name. Amen. So, friends, as I just shared, we are talking today about the effect of diabetes on the eyes. And I know that this is a very important subject to many of you. We are just seeking to, it appears that we have a technical difficulty. Hold on 1 second, folks. We have a problem. Okay, good afternoon again. I am not seeing that we are live, but I will just do a quick check on that. So if we are live, we apologize for that uncertainty. Wow. Something is wrong. One second. Okay, thank you for your understanding. It appears that we had a little technical issue there. I am trusting that the problem has been solved. I am not sure yet, but let's see. All right. Have we solved that? We had a little technical issue. Okay, so we are good to go now. Thanks for your understanding there. I am not sure what was missed, so let me begin again. This afternoon, we have with us Dr. Quintero. She was with us last week, and she's back again this week. And joining her is Dr. Monica Stevens. And together we are talking about the effects of diabetes on the eyes. It is a very important discussion that we're having, and I want to begin by asking about the effects. Well, just ask Dr. Stevens to review for us the basics of diabetes. When we say diabetes, what do we mean? Can you explain it to us, Dr. Stevens?
Okay, thank you so much, Pastor. Thank you for having me here on Let's Talk again. It's always a privilege to be sharing with my brothers and sisters. We have had the topic of diabetes on Let's Talk maybe about twice in the past, briefly and comprehensively. And this afternoon, I just want to remind our listening and viewing audience about what diabetes is, some of the complications, also the symptoms of diabetes. So, what is diabetes? You hear diabetes a lot. Some persons say sugar, right? But diabetes is basically a chronic disease in which the body's ability to produce or respond to hormone, insulin, is impaired. And when that happens, it results in an elevated level of blood glucose. So, for example, if we have a meal that is carbohydrate based, our body will break down the carbohydrate into a simple sugar called glucose. We know all about glucose, and glucose is the main source of energy from the body. In response to this increased glucose now in the body, the pancreas will release insulin. And insulin helps the cells to absorb this glucose so that it could use it for energy. But in diabetes, this process is totally disrupted. So either the body doesn't make enough insulin, that's type 1, and so you have to take exogenous insulin daily, or the body's cells don't respond properly to the insulin, and that is known as type 2. We also have the gestational diabetes, where when a woman is pregnant, the placenta releases different hormones which causes insulin resistance. It doesn't matter which type of diabetes you have, the result is the same. It leads to high blood sugar levels, which can damage many organs. When someone have diabetes as well, and we want to talk about the symptoms, what would they be complaining about? We often talk about the 3 Ps. Talk about polyuria, which just means frequent urination and a large amount of urine at that time. You also have polyphagia, that's increased hunger because the insulin is not taking the glucose into the cells so that the body can have the energy. And so you will feel hungry. Then you have polydipsia, increased thirst because you're urinating a lot. And so the body triggers that sensation for you to be drinking, drinking, drinking. We also have fatigue. Sometimes someone may come in and just complain about being very fatigued. And when we run their labs, you see that they do have diabetes, and you often have blurry vision. So those are the main symptoms of diabetes.
So we're sensing, therefore, that diabetes does definitely have some effects on not just the levels of sugar in the blood, but it does impact the organs. And you
That's
ended there
right.
by talking about blurry vision. Now, that's interesting because this afternoon we are discussing uh, effects of diabetes on the eyes. But could you say a little bit more about some of the complications when one gets diabetes? Now, you indicated that an individual may be urinating often, an individual may feel a bit lethargic and may have some blurry vision. But could you just say a little more, Dr. Stevens, before we
Okay, very
go?
good. Sure. So as this person who's living with diabetes continues to have increased levels of glucose in the body, that glucose level damages blood vessels and nerves throughout the body. So we can have cardiovascular complications such as heart attack and stroke. We can have kidney disease, which is called nephropathy. That's just damage of the kidneys because of the high glucose. You have nerve damage, or what we call diabetic neuropathy, and that's where persons often have pain and numbness and tingling in the feet. They're not able to feel their feet, and so sometimes if they have injury, then it can lead to an ulcer. The ulcer becomes infected, and it can also lead to amputation. And also we have eye damage. With the eye, you can have diabetic retinopathy, you can have macular damage or macular edema, the cataract, the glucose, and Dr. Quintero will talk a lot more about that. You also have poor wound healing, as I mentioned earlier. And these are the main complications that diabetes can have on a person's body.
So while we are zeroing in on the eye this afternoon,
Mhm.
it is important that we do not overlook the fact, and I want our listeners to give attention to the fact that diabetes has a significant impact on various organs. it is something you want to give attention to. I noticed that our population seems to be getting heavier in terms of weight management. And that is a concern because I know also that there is some degree of association between things like hypertension and diabetes, and there seems to be relationships likewise there. But Dr. Quintero, I want to get to you now. We are talking about the effects of diabetes, specifically in the eye. Dr. Stevens just reviewed for us some of the, what exactly we meant by diabetes or what we mean by diabetes, but also some of the general things we can expect. Before we go into the eye, however, can you just share some general things that our viewers need to know about the eye and eye care before we get into the effects of diabetes?
Yes, thank you so much for inviting me again. It's a pleasure to be with you, and I need to congratulations because this is a hard work you're doing and an excellent job to prevent this disease. I will share one slide because I want to show a video for everyone here can understand what really is diabetes retinopathy, okay? Let me share the video. And before that, I want to say thank you for my team because the team is what makes this happen. All these people and more helping in Antigua to make prevent this disease. And I want to talk about what is the prevalence now, okay? In the International Diabetes Federation, say approximately have 500, more than 500 people, millions people have this disease. And in 2040, we will have 700 millions. I mean, this is a problem we have, okay? And the prevalence in Antigua, we say about 12% of the population have diabetes. And we can say undiagnosed, we have 2,500 people undiagnosed with diabetes. And these people can have affection in the eye. And I want to show you this video because I want each of you can understand with a model for you can remember because your vision can be 20/20 or good vision and you can still have diabetes retinopathy. Let me show you this video. Can you see the video, guys?
The retina is
Yes,
the
we can.
light-sensitive tissue lining the inner surface of the eye. It receives visual images and converts them into nerve impulses for the brain to perceive as vision. Retinopathy is disease of the retina. It typically involves damage of small blood vessels that nourish the retina. Retinopathy can have different causes, but the two most common are diabetes and hypertension. In hypertension, persistent high blood pressures weaken small blood vessels everywhere in the body, including the eyes. Some patients may not be aware that they have hypertension until visual symptoms due to retinopathy develop. Diabetes is by far the most common cause of retinopathy. High blood sugar levels can damage blood vessels of the retina just like any other blood vessels. Diabetic retinopathy can be non-proliferative or proliferative. In the early non-proliferative stage, weakened spots on blood vessels may bulge, forming tiny aneurysms. These aneurysms can bleed or leak fluid into the retina. When this happens, patients may see floating spots or strings. Some patients may experience eye pain or redness, while others may have no symptoms.
Sorry for that. And I want to tell you something important about this stage. When he's talking about we don't have symptoms, and I will put it right here. We can have diabetes retinopathy without any symptoms. I mean, at the back of the eye, you have change and your vision can still okay. When your diabetes is affected, this is the normal eyes. Okay, I want to show you this in my end. This is the optical nerve. This is the connection you have with the brain, okay? And this is the center of the vision, where is the macula. When you have diabetes, at the back of the eye, your vessels start to leak because what Dr. Steven explaining, okay? That vessels get the glucose level go up and down, up and down. and start to leak and bleeding at the back of the eye. And that leaking, okay, not only coming with fluid, coming with cholesterol, that we see this deposit of cholesterol. This is the heart exudated here. So what I want to show you is with a testing, a patient can be totally normal with a testing at the back of the eye. Can happen, can be this patient, and after you can be the next one, okay? And this is important because this is the only testing we have. I will stop to sharing my screen to explaining something. Diabetes is something we can prevent, diabetes retinopathy. And the only way we can prevent this disease is when you have the diagnostic with diabetes, you need to see the eye doctor. Either if your vision is okay, either if you're feeling okay and you have a normal life. And the reason is because we need to start to make a baseline to be sure you keep your vision in the following years. I mean, you need to have regular checkup because it's the only way we will diagnostic before it start to happen the damage at the back of the eye.
So let me interrupt you again, Dr. Quintero. It is alarming. You shared a couple of things there. One of the earlier slides you showed listing the number of persons worldwide. I saw 537 million people worldwide who are diagnosed with diabetes. And in Antigua, out of a population of 93,000, you are indicating that there are 10, I don't remember,
12% of the population, more than 12% of the population
12%.
will have diabetes or receiving treatment for diabetes right now. Any patient receiving any treatment for diabetes. That don't mean you have diabetes retinopathy. That means you are in that percentage of the patients receiving medication for diabetes.
For diabetes, yes. But you also indicated that there are another 2,500 persons who are likely to be undiagnosed. Individuals who may be walking around with diabetes and may not be aware of it because perhaps they have not gone to a doctor, they have not been tested, etc. Now, so that's the first point I wanted to highlight. But secondly, I thought I heard you say, and I want this emphasized again. If I go to Dr. Stevens and she does some tests on me and says, hey, listen, Dr. Greene, sorry to tell you, but you're diabetic. You know, you are saying that my next step should be to visit you. Once I am diabetic, I need to get my eyes checked, whether or not I have symptoms, whether or not I have any issues with my eyes. Am I hearing you correctly?
Yes, it's correct. Any patient has diabetes type 1. We need to count 5 years from the first diagnosis and need to have a checkup from the eyes. Diabetes type 1, Dr. Steven can correct me, is more young patients. Is this patient with the insulin and all these problems? These patients are young patients, okay? Usually, we know the statistics show us that 5 years after the first diagnosis, we will have change at the back of the eye. I mean, after that is year visit. Either if you are okay or not okay, you need to have pictures of the back of the eye, a fundus dilated exam to be sure you are on control. The other way, we know are sure. We know are sure. And when we are not sure, we are like, we don't know. We don't know if you have or not. I mean, any patients with diabetes type 1, the first diagnostic year, all the doctors know this and they refer pretty good these patients, okay? They refer to the eye doctors and we check once a year, only either if the patient doesn't have anything, we need to be sure they don't develop anything because this diabetes retinopathy can develop the type 1 really can be aggressive in the eye because the patients are young. The type 2, the typical when you go to the doctor and the doctor tell you your glucose levels is a little high, your HbA1c is a little high, and they put you in treatment. These patients require eye tests once a year, either if you have symptoms or no. And the reason is because the eye screening and the prevention is the key to keep the vision. We need to be clear about this. We want to treat patients or we want to prevent. And if we want to prevent blindness, we need to have correctly diagnostic. That means each patient have diabetes require an eye test once a year to be sure at the back of the eye you don't have change from diabetes. If you don't have change from diabetes in your first visit, will be once a year. If you have change from diabetes, depend to your eye doctor, he will let you know if you require appointment frequently or if you require treatment from diabetes.
Okay, interesting. So I suppose I can't emphasize enough the importance of when I visit my doctor and my doctor says you are diabetic, that I should also make an appointment to get checked, get my eyes checked. Dr. Stevens, let me just jump to you very quickly and ask you this question. So when you diagnose me with diabetes, you will also tell me to go and visit my doctor, my eye doctor.
Yes, definitely. When you have patients, especially patients who have NCDs or the non-communicable diseases, you always want to refer them to the ophthalmologist to get their eyes checked. And even sometimes if a person have had diabetes for many years and they come to me for the first time, I will ask them, when was the last time you had your eye examined by an ophthalmologist and what were the results of those tests? So I always ensure that they go. And if they said, no, it's been a while, I really encourage them to go and have their eyes tested. We often say early detection saves lives. And I always add, and save eyes, because with the NCDs like diabetes and high cholesterol and hypertension, the eyes are affected. So not only save lives, but also save eyes.
Interesting. All right. Dr. Quintero, let me get back to you now. You mentioned diabetic retinopathy. I think that there may be a number of persons who maybe for whatever reasons have not associated diabetes with the eyes. We do understand, however, and as I've indicated before, you have shared a bit on diabetic retinopathy. There is also diabetic macular edema, there are cataracts and glaucoma. We spoke a lot about glaucoma last week, but I want you to just expand on these. I mean, you already started talking about the first one, and the diagram you showed there, that little video was very interesting. I was looking with interest. What do I need to know about this diabetic retinopathy?
I will tell you something important here. I tell all my patients, if you have diagnostic with diabetes, you need to check your eyes. The checking with the eyes, I will be clear about this. Optometrists in Antigua, they are doing a great job to helping us to prevent and treat this disease because they're referring us on time. They really do a screening excellent, and we together, we can fight with this disease, okay? When you have the first diagnostic with diabetes, you need to check your eyes, okay? And when you check your eyes and your eyes are okay, it's okay. You will come back in a year. What happens if your HbA1c is high? This is a blood test related strictly with diabetes, okay? And we know this HbA1c, when it's over 7, okay? When it's over 7, we can have start to change at the back of the eye. But this is related with how many years you have with diabetes. If you have diabetes type 1 and you have more than 5 years, 25% of the patients can have diabetes retinopathy, okay? When you have more than 10 years with diabetes and your diabetes up and down, blood sugar up and down, you have about 60%, okay? And when you have more than 15 years with diabetes, you have a chance to develop until 80%. To me, this will be related for how well is your control. Do we have three things we need to know here? And I want to be clear about this. Diabetes retinopathy, the eyes cannot walk by themselves. You need to have healthy body for you to have healthy eyes. If I want to tell you something, we are the reflect about what we eat every day. Please make smart decisions when you eat. If you have diabetes, you need to see a dietitian. The dietitian will be your best friend. And it's hard for you, and it's hard for me, it's hard for everyone. We are the reflect about what we do every day. Nobody wants to do exercise sometimes, yes. I will tell you this. If you want to have good eyes, you need to do exercise. Because no matter how many medication, injections, or things I do in your eyes, I cannot help you enough if you don't put the diet first or the style of healthy style of life plus the exercise. And the third thing will be the medication. And now I will answer your question. When we have diabetes retinopathy, the vessels at the back of the eye start to get sick and start to get leaking or bleeding at the back of the eye. When they start to get leaking, okay, we develop something swelling at the back of the eye or macular edema. Let's go to start for the beginner. What is the macula? The macula is the place of more powerful vision in the eye. If you have your retina is okay, but your center of the vision has swelling, you will start to have symptoms of blurred vision or a little. And now we have excellent treatments for that. I tell my patients, this is not about only putting treatment. We need to try to prevent this happen in your eyes. To me, you need to do the three things together. You need to do the diet, the exercise, and going to your doctor. Your doctor cannot cure you from diabetes. Your doctor will guide you and help you for we can fight with this disease together. The macular edema is swelling at the back of the eye. Is your vessels with the blood sugar up and down, cannot tolerate anymore and start to leak and start to swell. That is the macular edema. Is the center of the vision is affected by diabetes. This is the reason sometimes it's hard to diagnose diabetes for patients because some patients doesn't have diabetes retinopathy without central vision problems, without macular edema. I will show you, I want to show you for be clear what I'm talking about. I will show you a picture to you understand what is macular edema, okay? Let me share here my screening. 1 second. Share. And I will share this here. This is the macular edema. This in the center. But has patients doesn't need to have macular edema and have diabetes retinopathy. Okay? To me, the diabetes retinopathy is all these peripheral changes we have can include it with macular edema or without macular edema. Okay? So I want to be clear. For your right to have diabetes retinopathy, you need to have a normal eyes first. And we need to try to catch the patients when have normal eyes to avoid or treat diabetes retinopathy. Prevention is a key, guys. Go to your eye doctor, optometrist, ophthalmologist. Go and check it at the back of the eye. Each time you're checking for your glasses, be sure you're checking your blood sugar and be sure you tell the doctor, please check at the back of the eye to be sure I am okay.
Okay, let me ask you. I didn't mean for you to take the vision. Can you put back up that slide? I want to ask you a question there. If you can share again.
Yes.
So this question is, okay, so in the normal retina here, when there is diabetic retinopathy, then the blood vessels become swollen, and perhaps you mentioned that they may have aneurysms, right? Correct?
Yes.
And the eyes begin to be affected that way. Is my understanding that can progress? So are we progressing from diabetic retinopathy to macular edema? Is it one moving to the other, or they're separate?
This is not a line like this. This is not like this. Okay, we can have a little different stages. Okay, number one, you can have macular edema. Okay, with early changes of diabetes in your retina, you can have macular edema only. okay? And we treat your macular edema from diabetes, okay? And have macular edema for other things, but let's go to focus on diabetes right now. The thing is we start from non-proliferative diabetes, and I don't want to get more deep here, but I want you to understand something here. You can have early change around your eyes, some small vessels leaking, some small bleeding there, and your central vision can be okay, and you can feel you are okay. But the reality is we don't pass from no diabetes to diabetes proliferative that we are almost blind in 1 month. That don't happen. Happen progressive slowly. And happen is because we don't go to the doctor, or we have another thing. We have when the doctor telling us, hey, you have this, and maybe I refuse to have the treatment. What I tell refuse, maybe you treat your eyes, but you still doing the same. You don't do exercise, you eating all the time, you drink your calories, coke, juice, anything you want, and of course your level of sugar will up and down. And if you don't control the cause, we never will win the battle with diabetes retinopathy. If you want to have healthy eyes, we need to have a healthy body.
Yes.
You cannot pretend to put an injection in the eye, laser treatment, going to the doctor and be about you eating and drinking soda and drinking juice and eating all the mangoes you have in your house and think we are attacking the diabetes. We need to be coherent when we do this. I tell my patients all, do the three things at the same time. Taking care of your diet, making smart decisions each time you will eat, do the exercise, and follow the instruction for your doctor. Don't only medicine, only tablet, only insulin, only injections in the eye, don't will be enough.
Now, Dr. Stevens, as Dr. Quintero was talking just now about the relationship between good health and good eyes, my mind reflected back on a program we had before. We had the dietitian and yourself, I believe it was, the whole matter of being able to have a disciplined lifestyle where you are living, not waiting until you get sick to begin to think about a change of the diet. I want you to make a statement on that, because a lot of persons will say, okay, I'm going to eat how I want now. If I get sick, I'll go to the doctor. And I only make changes if the doctor tells me to make changes. So can you just speak to that very quickly?
Well, I'm so happy that Dr. Quintero mentioned, number one, it's important to go to the doctor to get your eyes checked. And number two, the eyes reflect how healthy the body is. And this is very true. I mentioned earlier about the NCDs, and two of them in particular are the ones that affect the eyes greatly, the diabetes and the high blood pressure. And we know that diabetes and hypertension or high blood pressure, they are generally lifestyle-driven diseases. And what does that mean? That means if you don't exercise, if you don't watch what you eat, if you don't sleep and control your stress levels, you are going to be at higher risk of getting these diseases. And once you have these diseases and you take medications, and many times patients often miss their medications, not following up with their doctors, not going to the ophthalmologist to see if complications have set in, then this is what's going to happen. The disease will progress. In our population, whether Afro-American, Afro-Caribbean, African Americans, we are at high risk of developing NCDs. And so it behooves all of us to ensure that even if we have these diseases, that they are managed properly. And again, it comes back to lifestyle. And I know it's difficult. Dr. Quintero said it. It's easy for us as doctors to talk, but we also struggle with the same thing. When we are so busy, sometimes we don't get enough exercise, but we recognize how important it is to exercise and eat properly so that we can delay or prevent complications later in the future. from these non-communicable diseases?
I'm here thinking, and I want to ask Dr. Quintero, um, if someone has diabetic retinopathy or macular edema and is then able to manage his or her diabetes to the point of putting it in remission, will that also take care of the retinopathy or the edema?
And I will tell you this is controversial one part, but I will tell you when the vessels at the back of the eye start to leak a level of the swelling, you require different treatments that is injections, laser, or surgery. The change at the back of the eye is there, okay? And we will try to keep the vision you have. We will be, I don't want to make, I want to give a hope to the people, and I want to be sincere what we can get, okay? The objective. When you get diabetes retinopathy in the first stages, we can bring back that with treatment and with the style of life you will do, and your vision can be the same how it was before. And you is still in risk because you will still have diabetes. We don't cure the diabetes because I put you a couple injections or laser. No, no, no.
Mm-hmm.
You will still have the diabetes. If you in one period you don't take care of your diabetes, you will develop diabetes retinopathy again.
Mm-hmm.
Okay? So I tell my patients, if you don't want to be in the circle of putting injections, laser, and treatment in the eye, you need to take care of the cost. But have a reality when you arrive to the doctor too late, when the vision is really blurry, when the doctor tells you have bleeding at the back of the eye, and now you will require injections, laser, and in the latest stage, vitrectomy or surgery for the retina, the prognostic of the vision is reserved, okay? Because the blood, like any place in the body, the blood supposed to be inside the vessels. When the blood is outside, that develop inflammation, damage at the back of the eye. And sometimes we cannot bring that damage come back to the normal, okay? Because that cells are weak. So here the prevention is a key. When your doctor tell you are okay and you will come back in a year, excellent. When your doctor tell you, hey, we will give you a chance. Your HbA1c is in these levels. Let's go to work with your medical doctor, your internal medicine, your family doctor, your general practitioner. Your doctor is with you all the time. Okay, you will go. And this is your opportunity to do exercise and work with your dietitian and take care with your medicine, take your medicine, and we will see you back in 3 months. If we see in 3 months you are getting better or you are in the same stage, we can keep observing you. But if we see you getting worse, you will require treatment. And I will tell you all this to my patients, and all the patients around the world see this program. When you receive treatment from diabetes, either if injections at the back of the eye, either is lasers at the back of the eye, this is to improve or trying to keep the vision you have. Depend of the stage of the diabetes will be the prognostic of the vision. But if you don't take care the cause, if you don't take care the up and down blood glucose level, we don't will win the battle. If you want to have good vision, you need to have a healthy body.
Mm-hmm.
Well said. If you want to have good vision, you need to have a healthy body. I like that. Let's talk now about cataracts, because we are told that, well, my understanding is, and I want you to correct me, Dr. Quintero, I understand that persons with diabetes are 2 to 5 times more likely to develop cataracts than those who don't. Am I correct?
Yes, you are correct.
I'm correct. So I want you to tell me why that is so and
Mhm.
how diabetes causes cataracts.
And this is related with the patient have up and down blood level of glucose. Okay? If your level of glucose are more controlled and your diabetes is controlled, your lens, because what is cataract? No, let's go to start from the beginning. Cataract is the natural lens of your eye get cloudy, can get cloudy for the age. Okay, like any patient in one part of your life, you will require cataract surgery. Okay, and cataract is a cloudy vision. The natural lens of the eye get cloudy, and we need to do surgery, and it's a safe procedure. Okay, but when you have diabetes, you have the age now, and plus you have up and down the sugar levels, the blood glucose level up and down, and that can cause chemical change inside of the lens, of the natural lens, and increase the cataract fast. So I mean, increase the cloudiness in the natural lens. And that is the reason that is the reason you say the cataract, the glucose or the diabetes increase the size of the cataract. And we have some typical cataract from diabetes, But the reality is if your level of glucose up and down, you will have cataracts at the same time. You can have diabetes, retinopathy at the same time, and you can either have one type of glaucoma that is devastating glaucoma, is a neovascular glaucoma. That means the vessels at the back of the eye not only growing at the back of the eye, now growing in the draining system and blocking the draining system and increase the pressure. All these can be prevented if you come to your doctor on time. You don't come from zero diabetes retinopathy to diabetes retinal aggressive that you require surgery, multiple surgery, or multiple treatment in 1 month. That is not true. You need to have a period. I will tell you this, and I want to be clear with the patients. Any patients start to see, I have a black spot, and 3 days after I feel better. And another day I have blurred vision one day. And when my sugar is up and down, I have blurred vision. You need to check with your doctor because that blurred vision can be bleeding at the back of the eye that you don't notice.
So before I get back to Dr. Stevens, so I'm hearing here that diabetes is a terrible thing to have for the eye. Its effects on the eye, and it can do so much damage. That's pretty serious. So again, Dr. Quintero, you have been emphasizing the need to check your doctor. That's good, solid counsel. And I hope our viewers and listeners, those of you who are following in Second Advent Radio, I hope you're giving attention to that. I want to switch to Dr. Stevens now for a minute. Dr. Stevens, what I'm hearing here is that once you realize that you're diabetic, you need to take action and you need to take action quickly. But let's go back to before you're diabetic, because I'm more concerned about prevention rather than cure, right? So talk to me, the normal person, individual A does not yet have diabetes. How does this individual need to live to avoid getting diabetes so that all of these complications that we're talking about can be avoided in the first place?
Excellent question, Dr. Greene. And when I talk to my patients about the lifestyle changes, I like to put them in 2 categories that I have started with some time ago. I didn't see this anywhere, and I put my own mnemonic to it. I talk about the TTAs and the TTS, things to do and things to subtract. Okay? So let's talk first about things to do. First of all, we want to ensure that we have a balanced diet. And when I say balanced diet, I'm talking about a diet rich in whole grains, vegetables, lean protein, and healthy fats. Okay? We often say that, oh, eating healthy is expensive, but try going to the doctor with diseases and complications and having to have surgery, right? So there are definitely things that we can do to stay healthy. Secondly, exercise regularly. And that's something that we often struggle with, and we say we can't find time for exercise. But if we find time for exercise, we'll realize that we'll get a lot more things done. Our minds will be sharper, we will feel better, we'll be in a better mood. So at least 150 minutes per week. You could break it down however you want. Most recommended is 30 minutes a day. Moderate activity like brisk walking or cycling, swimming, dancing, whatever you want to do, just ensure that you're getting that heart rate up, it's plateauing, and then it's going back down. And to know whether or not you're really getting the exercise that you should be getting, you should not be able to make a complete sentence. So if you're walking with someone exercising in the morning, and you can talk about Jane and Sally and what happened last night, and they can hear you, they can understand you well, it means that your exercise is not vigorous enough, so you need to do brisk walking. You also have to maintain a healthy weight. It is thought that if you're overweight or obese and you lose about 5 to 10% of body weight, that can make a big difference in your blood sugar control. Then we come to the sleep. We cannot forget the sleep, because when you sleep, lots of functions happen with the body, lots of repair happens. So when we say 7 to 8 hours, and busy people like Dr. Greene and Dr. Quintero say like, oh, I can't get 7 to 8 hours. That's difficult. It means we are putting our health at risk. So we have to ensure that we get those hours. Dr. Stevens as well. I'm guilty about the sleep part, okay? I must say that. We also have to stay hydrated. It's very important to drink. Dr. Quintero mentioned this as well. Have your regular checkups. Have your eye examined, your blood pressure checked, your cholesterol, and your glucose monitored, even when you don't have these diseases as yet. And also manage your stress. Meditate, pray, do deep breathing. And if you have to seek a help from a counselor to help you get over some of those life stresses, then you do that. So those are our TTAs, things that we need to add. What about our TTS? Things that we need to subtract. Processed foods. All those things in a can, we get home, we don't have time to put on any beans, we open up that can of corn, that can of potato, that can of broccoli, that kind of whatever. Those are highly processed food. Also, the sugary beverages. You do not need to have a juice every time you have a meal. You can have a fruit after and drink some water. A friend of mine always say, a fruit and water equals juice. And then smoking, subtract the smoking and also the alcohol. Studies are saying that we should limit the intake of alcohol, but as Seventh Adventists, we say no alcohol. However, now other places are really saying, like Canada, and now saying no alcohol. That's the best way to go. So those are our TTAs, our things to add, and our TTS, our things to subtract.
All right, so you have given us enough there for 2 weeks of Let's Talk. It's very interesting in terms of managing this lifestyle. We want people to understand that this is we're talking about something that can change your life.
Yes.
And when an individual gets to the point where they have to be hospitalized, where they have to have all these needles stuck in their skins and they can't move as they want to, when they are losing their vision and they're next going to get dialysis and all the rest of it and so on. It's a total change, and you don't want that. So we're trying to get the message out there that you need to give attention to your health. One of these days we're going to talk about those processed foods. I want to plan a program just to deal with processed foods, because we live in a fast food era, and people want the easy way out. Nevertheless, I have something else I want to talk to Dr. Quintero about. So you mentioned cataracts, you mentioned the edema, you mentioned the other areas, the glaucoma, etc. Um, is there such a thing as eye exercises? And if so, do they really help? Um,
Eye exercises?
yes.
No. Those are, we need to do real exercise where we get sweat. Okay? Eye exercise, no, really, that will help you in any way from diabetes retinopathy. And one thing I will add from what Dr. Stevens said is we are the reflect about the 5 people around us. Okay? If you have your closest friends are people doing exercise, eating healthy,
Sorry, could you repeat yourself there? I missed a bit of what
Yeah.
you said.
we are the reflect about the 5 people around us. If our friends are people that really take care about the healthy style of life, do exercise, you will feel more to do that type of things. Okay, and then be sure you try in your family members support each other. If you have one person with diabetes, try to support your family members. This is something we need to fight together like a family. Cannot one person eating healthy and the other ones eating what they want? Because it's hard for the patient with diabetes. I mean, we need to try to be all of us together to help each other. Okay, Bao doesn't have any eye exercise we can do to prevent the diabetes. No, we need to do the real exercise, like what the Dr. Stevens is talking about.
Now, I wasn't really asking as a substitute for the real exercises, but I was speaking more in general terms. You know, for example, they say that sometimes you must look at things far away and not just be looking at things close by. So I was asking a general question whether
Yes, these kind of things is different because that can help you with the dry eye. Okay, really, you need to have some period of time every 90 minutes. You really need, or every 90 seconds, you are focused on something. You need to blink. Now this is with dry eye, not with the diabetes. The diabetes by themselves is the reflect about what we really do when we eat and what we do every day. No, is something about how we use our vision. I tell my patients all the time, enjoy your vision, do what you want, read, watch TV, enjoy your vision. The important part is you take care what is the cause and it's the diabetes part. Okay, this is not something happening in the eyes and it's not happening in the body. It's a reflect that how your body looking. Okay, if your body is sick, your eyes will get sick. The only thing is sometimes the patients only have symptoms in the eye because of blurred vision and all this. But your body is the reflect, your eyes is the reflect of your body. Okay, your eyes is telling us what is happening in your body. Maybe you don't feel another symptoms, but soon after the diabetes retinopathy, you can start to problems with the kidneys. You can have a heart attack, how say Dr. Stevens. I mean, this is a problem we need to treat complete, okay? Because it's not only the eyes is working by themselves.
now last week, sorry, you were going to say something, Dr. Stevens.
I really have to say here, Dr. Quintero and I share a very special person in our lives. And I remember when that individual came to me, she told me, my ophthalmologist said that there's something going on in my body. She is seeing that something is wrong with the eyes, but it's coming from what is wrong with the body. All right. And so she was able to send her to me, and then we figured out what was going on. So Doc is so right. From the eyes, she could tell that a lot of things that is going on in the body.
Now, last week, thanks for that. And by the way, I was supposed to comment that as you mentioned, those things that we ought to do, the sleep, you know, is one of the areas that a lot of us are challenged with.
Yeah,
Yeah, but I pledge to do better in that area.
me too.
Now, last week, Dr. Quintero mentioned that individuals who use marijuana can experience irregularity in the pressure in the eye that can lead to glaucoma, or can increase the rate of the degeneration. So we have that. We have now this week, we are told that alcohol, excessive alcohol, and a few weeks ago, Dr. Bell Jarvis indicated to us that there is no safe level of intake of alcohol. But when we put all of that together, and with the abundance of the sugared drinks that we have so cheaply available in the supermarkets, my question is, isn't it true that sometimes the government is contributing to some of the impact because the things that are not good for us are made so easily and readily available? I know this is a little ticklish area and we don't have much time, but at the end of the day, the cost of healthcare becomes a serious burden to the government, because the health industry ultimately, the healthcare system has to be maintained. Why make it easier for people to get sick? I'm not taking away individual responsibility, because everybody is supposed to be responsible enough to be able to manage his or her own choices and understand what consequences these choices have. But should we not expect our authorities to try to, put some taxes on these sugary drinks rather than making marijuana more available, tighten the use of, regulations concerning the use of these things? And if you get my point, we seem to be making it easier for people to get things that are not good for them. And the things that are healthy, the things that are promoting good health, they become very expensive. And some of these things that are not very expensive are made so easily available. I don't know which one of you wants to, which one of you want to address?
Okay. Okay, I'll start. What I can say is about 15, 20 years ago, when we talk about NCDs, whether it is diabetes, high blood pressure, high cholesterol, we focus mainly on the individual. It's almost like we were saying, it's your fault. You're the one who caused this. It's because of what you did to yourself. And you need to buckle up and you need to wake up and do things differently. But now we are seeing that the environment in which one lives can also contribute to these NCDs. As you rightfully pointed out, Pastor Greene, is that if we are going to have things that are readily available and that are cheaper, that are not good for us as a people, we're going to gravitate to those things. And so I can tell you that there are lots of policies that are in play as we speak to have taxations on sugar beverages, alcohol, tobacco, and several other things. But these are at the policy level, and it's not something that happens right away. They have to be vetted, they have to be voted on, and there are a lot of other persons whose interests or who benefits from these things. And so there are much pushback in some of these areas. But you're right, it's a collective body, it's the individual, it's the community, and it's the government.
Okay, thank you so much. Dr. Quintero, I'm going to ask you to provide a summary for us of, our time is just about up, but if you can provide a summary of what we shared this afternoon so that folks would remember what they need to, the key points of the message that you were seeking to share today.
I will say the key points is your doctor, you need to see your doctor, and your doctor need to have blood testing for you. You need to do a blood testing to be sure your sugar is controlled. Once you are diagnosed with diabetes, you need to have check your eyes once a year with the ophthalmologist to check at the back of the eye. Together, we can fight with this disease. And you need to do 3 things. See your dietitian and follow the instructions from the dietitians, okay? Do exercise like a medicine. The same way you take your medicine every day, do the exercise like a medicine. It's better to do 30 minutes exercise than don't do anything. To do the exercise like a medicine, okay? And exercise is not walking in the town. Exercise is doing the sneaker shoes and you go and do it. Let's go to do this. And it's hard for you and it's hard for everyone. And follow the instructions for your doctor. If your doctor tells you you require treatment from diabetes retinopathy, try to do it as early possible, as soon as possible, because that can prevent the blindness for you. But don't do the treatment only and don't take tablets or take injections or take insulin or take miracle pills thinking this is the only thing you will do. You will need to work hard on this. Make smart decisions what you will eat every day. Do the exercise and take care with your doctor, okay?
Well, thank you so much. I want to express gratitude to all of you for sharing today. We do appreciate it. Diabetes is a deadly disease. It is life-changing. It is something that you want to not to have to deal with. So I would just add that all of you who are listening, whether you are diabetic or not, you need to take action, watch your diet, consult your nutritionist, ensure that you are not allowing appetite to rule you. Be sensible in your choices. Be sure to engage in your regular exercise programs so that you can have, in combination with your diet and your sleep and the fact of being hydrated, etc., so that you can be healthier. Your children will love you for it. Your spouse will love you for it. Your significant others will love you for it. The government will be will have the less it will reduce the care costs, and you're going to be enjoying good health and live a longer, more prosperous life. Next week, we are going to be talking again with Dr. Bell Jarvis. A few weeks ago, we started a discussion on the first 1,000 days of a child's life. We only did cover about half the things we wanted to explore. And so next week, we're going to continue that discussion. And I want to urge all of you, those of you who have young children, those of you who are planning to get married and are planning to have children, those of you who are grandparents and you like to have your little grandchildren around you, etc. This is a program that you want to make sure you don't miss out on. We have some very important things to talk about. So that's next week coming up. Until then, we are going to say, God bless you. It was a pleasure sharing. And please take care of yourself, take care of your health, and see you again next week. God bless.
Bye-bye.